Hello, Sonoma County. This is Dr. Walter Tom on Ask the Expert, and I'm here with Karina,
Hi.
our trusted surgical liaison. Good morning,
Hello.
Karina. How are you?
Well, it's good afternoon now.
Oh, I guess it's good afternoon. It is. And who do we have manning the control tower?
Yo.
It's Jeff, and he's been taking care of us. I want to thank everybody on this beautiful January the 16th. I can't believe it. I'm from Michigan, and this weather is amazing. We just got here in time to the studio to start the show. The traffic around town has been a little bit crazy, hasn't it?
Yes, it
Yeah,
has.
crazy. Have you been reporting that in the news, Jeff?
No, but it's like right in front of the building too. So whatever they're doing, they need to get it done quick.
Okay, so now you know. Here we are live again, and so I want to again thank everybody for always tuning in and listening to us from 12:30 to 1. We're so glad that you could join us today, and so we always have an array of different things to talk about.
Yes.
And Karina, so I thought we'd kind of go back to the basics. What do you think our most popular treatment is at Dr. Tom Cosmetic Surgery?
Botox and Dysport.
Botox and Dysport, absolutely. So this is taking me back 18. I've been doing this for about 18 years now on KSRO, and we've been talking about Botox and Dysport for about 18 years
Right.
now. Karina, we talk about patients coming in to see us, and it is absolutely the most popular treatment, non-surgical treatment that we offer, and it's been that way for decades now. The American Society of Plastic Surgery, every year they come out with their most popular treatments, and Botox in the United States always leads the way in terms of what patients want. So what do patients want when they come in to see us?
They want to feel great. They want to feel good about themselves.
Okay, so they want to feel great. They want to feel good about themselves. Okay, and so what does that have to do with Botox and Dysport?
Yeah, I think that always the number one concern usually for most patients is I look tired or I look angry. Yeah, those are kind of the words they use. Yeah.
Right. And so what part of the face when we talk about that scowl, okay, the scowl face or the RBF, okay, what is the area that mostly people are concerned about?
Definitely the frown.
The frown.
Yeah, it's an area of concentration. It's area of frustration. Those kind of that area.
Absolutely, you're right. Area of concentration, frustration, and for those who don't know, the frown, or for you anatomic technical people, that's the glabellar area, and that's the area between our eyes, just above our nose, right? And so that's the area where we get the 11s, and we get the frown, where we show that area of concern. Maybe we're angry, maybe we're tired, and it's interesting that you say that, because I'm a patient just like all of us, right? And so I had been getting Botox and Dysport now for the last 20 years, and one day I just sort of thought, just like most patients, boy, do I even need to do this anymore? I don't need to do this. And I'm a guy, I don't need it. And I need to show concern, and I need to be able to frown a little bit for my patients. And so I stopped doing it. And my daughter, who now is a professor at Santa Rosa JC here, but she was back in graduate school back east, and she was just coming home visiting for the summer. And I came home, and I remember her saying to me, "Dad, what's wrong?" And I said, "Eric, nothing's wrong. I'm actually happy." And then my wife chimed in and said, "No, really, what's wrong? Are you okay?" And I thought, oh, I need Botox or Dysport. And so I immediately went back to the office the next day and said, "Shoot me up. Relax those muscles so that I don't look angry or upset in that area." So talking a little bit about Botox and Dysport, you mentioned Dysport. Most people by now know what Botox is. It's a muscle relaxer, Karina. And so with tiny little injections, we inject a small amount into the muscles of the face in areas that we call dynamic wrinkles. So dynamic wrinkles would be the frown that we have here, or it might be our smile lines, or what my generation would call crow's feet, which is on the side of our eyes. Or how about raising? We're going to be on YouTube, by the way. So if you're our radio listeners, all you got to do is go on YouTube the next day, and we're posting live our filmed live, I should say, on YouTube under Dr. Walter Tom on YouTube. You can subscribe to the channel, and we'll be on there, and you can see that. So for our YouTube listeners, raise your eyebrows. What are we looking at there?
The forehead.
The forehead, right. So Karina, that's an area as well. That's a dynamic area when people raise their brows, that they're concerned about those horizontal lines between their brow and their eyebrows. Okay, so those are dynamic wrinkles, and Botox or Dysport works very well. when patients come in, do they ask specifically for Botox or Dysport, or do they just come in and say, I want these
I
wrinkles reduced?
Yeah, I think most patients do know Botox can help with that.
Mhm.
So some do say Botox, and some we kind of guide them to the appropriate consultation or treatment for that.
Right.
Yeah.
So we consult with them, we study their faces,
Mhm.
and I know that you are, and to tell them which might be, we call these, by the way, neuromodulators. So they're actually affecting kind of the nerve release of acetylcholine. I know I'm getting kind of techno nerd on you, but our nerve endings release a substance called acetylcholine, goes down to our muscles, and it causes our muscles to contract. And so Botox or Dysport prevents
Mhm.
the release of that substance, and so our muscles are relaxed. When they come in and we're talking to them about that, usually I have you take photos of them.
Mhm.
So what do you do when you take photos to help us to make a decision?
Yeah, we ask our patient to animate the face or show us their areas. So smiling, frowning, raising up the eyebrows to really show
Mhm.
those areas of concern.
Right.
Mhm.
So first we take them sort of a deadpan
Right.
look, and then, as you said, we have them smile and
Mhm.
frown and raise their eyebrows. And so we study that, and we kind of look at the different angles. If you
Mhm.
take them multiple angles, and I appreciate you doing that for us, and then we describe what to do for them.
Right.
So Botox, which was released early at the turn of the century, okay, relaxes muscles, and that's what we're all used to saying. Very much like saying Kleenex when
Right.
we want a tissue. And so Botox is great in cosmetic doses that we do. It's extremely safe with a very, very great safety profile, low side effects. Mostly it's just maybe a little bit of a little bruise
Mhm.
sometimes that can happen whenever you put a needle in the face. That can happen, but luckily not very
Mhm.
often with Botox. So we use Botox in a lot of areas, and then along came Dysport,
Mhm.
Karina. And the difference is that I tell patients that Botox is a little bit more like a sharpshooter, and Dysport is a little bit more like a shotgun.
Right.
And so sometimes a shotgun's good, and sometimes a sharpshooter is better. So
Mhm.
we study the face and we decide, along with the patient's
Mhm.
input, what might be best for them.
Right.
And the ultimate cost is there a
So
difference?
no, we have it priced at the same rate so that there's no fighting within the two.
Okay, so there's no fighting. You can tell that Karina likes everybody to get along. She said no fighting.
Harmony.
So we have harmony between deciding on whether you want to use Botox or Dysport. We have it priced so really you just pick what's best
Right.
for you. It's not, oh, I can save $5
Mhm.
here. Let me use this other one. If it's not right for you, you're not really saving
Right.
money.
Right.
Okay, so we do that. So let's talk a little bit about treating the frown.
Mhm.
So let's say somebody comes in and they're scowling, or many times I'll hear a patient say to me that they're tired of hearing people say smile, or you look angry, or you look
Mhm. Mhm.
tired, or what's wrong, and they're tired of that. And so we treat that frown
Right.
area. How do we prepare them for a treatment? So, they're sitting in the chair, we've gone over things with them, we've consented them, and we're about to now do the procedure. How do you prepare a patient for a Botox or a
Yeah.
Dysport injection?
Yeah, so we always start by cleansing the face with a little bit of rubbing alcohol and a little
Right.
cotton swab to make sure that it's nice and clean and clean area for them. And you love your ice. We love icing the patient.
Okay.
It's helpful for their discomfort. And then we just go slow. You explain what you're doing as you go through the treatment, and usually not much discomfort for patients.
I would say
Yeah.
that most people actually do very, very
Mhm.
well with
Mhm.
this. And I've always joked on
Mhm.
KSRO Ask the Expert that I'm the president of the weenie
Right.
club, but
Mhm.
I'm an empathetic weenie. And so we do all the maneuvers we can to make this be comfortable for you. So you did a great job of describing that. So we're educating the patients along the way.
Yes.
One thing that's nice, I know that there sometimes are Botox parties and people coming to homes and this and that. One thing nice about coming to our office is, we're doing it in a clinical situation. We're doing everything sterilely,
Mhm.
clean, that we hold ourselves up to really high
Right.
standards. We're accredited by AAAHC, which is an accreditation body for our operating room. So safety is really important to
Right.
us, and we want to do it safely. And the fact that there's always follow-up available with us, because we're not going anywhere, right?
Right.
We've been here for oh my God, 25th year now,
Oh,
25
wow.
years, and I'm not planning on going anywhere for at least another 10 more years. So they come in and we do the treatment. So as you mentioned, we ice the area, and we ice it to help to minimize the discomfort of a tiny little needle prick. Also, the ice helps to constrict the blood vessels, so it helps to minimize bruising, Karina. And then I know that as I'm describing it and I'm telling the patient, you can feel a little touch, 1, 2, 3 poke, may feel a little pressure, maybe a little burning sensation, but it's very quick while we're doing that. What are you also doing to help them to be more comfortable?
Yes, we have a little distracting, a little mechanism. It's a little vibration device that can be placed on, on their head, a little scalp massage on the jawline, closer to the forehead to kind of distract them of what's going on.
Right, and it's a great little device, and so it's a distractor. It's a vibrating distractor, and I know that you used that on me. One day we were at our Maui Cosmetic Surgery office, and it was the end of the day. Patients were all gone. We had a little something left, and so our lead nurse Mary was going to do a little filler injection on me, and the first time you actually used that device and kind of put it under my jaw here while I was getting an injection, and it really does make a difference.
Right. Yes.
In fact, most people, if Karina just happens to not be in the room with me, they're saying to me, "Where's Karina? Where's Karina?" They know that Karina has a special device that helps to distract them, and so it's very much like a peripheral nerve stimulator. We're stimulating another part of the body while you're getting an injection, and it helps to minimize the discomfort. So you mentioned frown is the number one place, and I think that goes for all ages. What other areas do you think, what would you say is the number 2 area that people want to have done?
I would like to say the sides of the eyes, but I think it's the forehead. I think people really can focus on that forehead area.
It's interesting that you should say that, but I do believe you're true, and I think maybe it's even a little bit more true for younger patients. So we'll call them by generations, more of the Gen Z, millennials. I think that's a little bit more of their concern than we see in the older Gen Xers and baby boomers, but it is a concern of everybody. And so those are the horizontal lines on our forehead when we raise our eyebrows, okay? And so it can be very effective in taking care of that. It's a little bit of a trickier area. A lot of times patients think that that's sort of an elementary area. And even when we're training new people, new nurses or even physicians, and training them on the use of Dysport and Botox to relax muscles, we explain to them that the forehead, there are some nuances to it that make it a little bit more complicated. It's just not, oh, let me inject that forehead to get rid of the eyebrow raising. In other words, to get rid of the horizontal lines. What are some of the concerns that we talk to our patients about when we do that?
Yeah, we can, instead of, helping to open their eyes and kind of smooth that area, it can actually make their eyebrows droop. In some cases, that can be a concern for some patients.
And you're right. So the forehead muscles, it's called the frontalis muscle, they contract and they raise our eyebrows. And so if you're looking on our YouTube video and I'm raising my eyebrows at you there, that causes the horizontal lines. So in younger patients, so people like Karina in their mid-20s and 30s, maybe even their 40s, you can relax that muscle. And because they're younger, their eyes still look pretty wide open. And with specifically with certain techniques, you're still able to raise your eyebrows. Okay. However, as we get older and we begin to get our brows begin to drop, we need to recruit our frontalis muscle to open up our eyes. And so if we use too much Dysport or Botox in that area, we can inhibit that raising of our eyebrows. So, and that can have a negative effect on opening up your eyes. So for me, I actually live with my horizontal lines, Karina, because of even though I'm Chinese and Greek, my eyes are mostly Asian, and my eyelids hang down even over my eyelashes. So I'm constantly raising my eyebrows to open up my eyes. In fact, I always laugh when we're about to take a photo. I always open up my mouth more and I raise my eyebrows, and that's I just intuitively do that to kind of open up my eyes. I look at your eyes, I'm jealous. Look at your big eyes, and I want those big eyes. So I need to recruit it. So I will not treat my forehead, but on someone like you, I'll treat the forehead, no problem at all, and helps to smooth out that area. Uh, since you mentioned opening up the eyes, the frown area where we talked about the 11s, when we treat that area, one of the nice side effects is what do we see with that?
You can do some eyebrow lifting for the patient.
Absolutely. Yes. And usually, what part of the eyebrow do you see go up with that?
If there's an arch, usually in that area of the arching of the eyebrow.
Okay, so if you look at where your pupils are, look in the mirror, and look at where your pupils are, to the outside of your pupils, that's where we see an arch. So in women, a lot of times they like that arch. I can remember my grandmother, bless her soul, I can remember her kind of painting the eyebrow arch on her face, right, with their makeup. So that using Dysport or Botox in the frown area can actually help to lift up the eyebrows on the outside, or what we medically call laterally to the side. If you're a football player, that's called lateral movement to the sidelines, right? And so that helps to open up the eyes, and women definitely love that. And so we talked about treating the frown area, we talked about treating the forehead. Then what other areas do we treat?
I think there's an area that some people don't think about, but the sides of the eyes can definitely help.
Right. So the crow's feet or the smile lines. And so some people may say to me, like, well, I don't really care about those lines. That doesn't bother me. And I still may recommend they treat that area. And the reason that I recommend that is not so much to get rid of those lines, but is to help to open up the eyes. If you were to put your finger just on the side of your eyebrow on the outside and you smile, when you smile, your finger tends to go down because we have this muscle around the eye called the orbicularis oculi, and it's a little circle muscle, and it constricts down and it pulls our brows down when we smile. So that's why our eyes tend to squint when we smile. And you just give me a really nice smile there. At your youngest, your eyes are still big, but you can see they kind of come down a little bit. So injecting Dysport or Botox in the sides to take care of the crow's feet actually helps to open up the eyes more.
Absolutely.
So if you are looking to open up your eyes, I definitely recommend treating the frown area or the 11s and the smile lines or the crow's feet. So absolutely. So that's great. I know there are some advanced areas, Karina, that we like to treat. What are some of the advanced areas that you've seen us treat with Botox and Dysport?
Yes, definitely the chin. The chin is a favorite. It's definitely a favorite. You know, I know that some of the people like the upper lip or the lips for a lip flip.
Okay. All right.
But I've seen, and then I'm trying to think. I also have seen you treat for the frown lines. You know, when someone has strong muscles,
a resting, not happy face, right? So as we look at that, so Karina, first you mentioned the chin. So there's a muscle there, and it's called the mentalis muscle, and we can inadvertently contract that, and when we contract that, we make our chin kind of go up towards our lower lip. And when we do that, it can get pebbly or look like a little bit like a Shar-Pei or a cottage cheese like. I've heard ladies tell me that a little bit on the skin there. But it also can shorten the jawline. And so especially as we get older, that's not a nice look. So injecting the mentalis muscle or the chin helps to drop that muscle down, relax it. It smooths out the skin in that area, and it more clearly defines the jawline. Going back to Maui, I remember, and when we had a little bit of time and Mary, our lead nurse, was injecting me, I remember saying to her, well, you know, she said, what do you want done? I said, well, I don't know. What do you think? And I remember her saying, well, duh, it's the chin, right? You want to because my chin muscle would kind of constrict a lot. And so we injected that and it softened that. I know we did that for you as well, right? And what did you think? Okay, so you're in your mid-20s, and why did we treat your chin?
Well, it wasn't an area that I was like, Dr. Tom, please treat my chin.
All right, okay, no, you didn't at all.
It wasn't an area that I ever, thought about. But once you pointed that out in a very kind way, and asked if I wanted it treated.
I didn't say, oh, look at your chin. I didn't.
No, it was very kind.
Okay.
Yeah, I definitely enjoyed the look, and over time, I feel like it has softened. That area with the pebbling and retraction of my jawline looks great. So.
And your jawline looks great. Oh, you're in your mid-20s, for God's sake. Come on. Okay, so it was interesting that I'll go into that story a little bit more for our listeners. So, Karina has joined our team, a great surgical liaison, surgical tech, and she keeps me, on the right path all the time. But, you were kind of curious, like, what could I do? And so I was actually asking you, maybe what is your cosmetic inks, and I'm looking at you thinking, she's got nothing wrong with her. Karina looks great. And you shared with me, do you remember what you shared with me?
Yeah, that I look too young.
You look too young, right? Isn't that funny? We get patients in that come in and say, I look too young. And most of us are thinking, God, I want to look younger. But absolutely, that was true. You were tired of people saying you look like a little
Right.
girl. And so what I noticed was that, I mean, you always have this wonderful, warm countenance to your face, and I hardly ever see you frown. Okay, in fact, I'm not sure if I've ever seen you frown, but I think that your frown is in your chin, and your muscle would contract a lot. And we were working during COVID, so you hid it from me a lot for a long time. I didn't know you were pissed off at me, but you really were. Okay, so you were upset with me, but so what I noticed was when that contracted, that changed sort of the architecture of your jawline. And by just treating that, you looked a lot more sophisticated. It was interesting. You went from beautiful,
Young girl.
young looking girl to a more sophisticated looking
Right.
young woman. And so I know that when we present that at meetings, that it's always a very dramatic, and physicians often comment on that, on the
Right.
dramatic difference it made for you. So that was treating the chin
Yes.
area. Okay. Now, something that I know you sneak off, and you have Mary inject you, not me. I don't know why, but you like the lip flip.
I
So
do.
describe to me, what is the lip flip?
So it's a very small pinpricks above the lip area, and it just kind of helps show more lip, I guess. I don't know.
Okay, all
I
right.
really enjoy the look. So.
You enjoy the look. Okay, so what was your hope when you were watching, I don't know, Instagram or TikTok or whatever you're watching, and you wanted a lip flip? What was it that you were kind of looking for?
I didn't really ever think about it, but I think we did it for training purposes with the staff member, one of the nurses, and I said, hey, I really like that. I never thought about it. So kind of like the chin. I didn't think about it, and we did it. Yeah.
And so it opens up, it everts your lips.
It gives your lip, it gives you a little pout of the lips.
Gives you a little pout. Okay, so that's just what I need, a pouty Karina working with me. So, so Karina, you had an injection. It was along the border of your upper lip, right? So you heard me. I got a little techno anatomic nerdy on you, and I said the muscle around the eye is the orbicularis oculi. Oculi is eye. Orbicularis is a round muscle. So our mouth or our lips are the orbicularis oris. And so that contracts as well. So a lot of times injecting on that top lip, it helps to soften, in some patients, the vertical lines that we can see, but we noticed that the lip actually gave you a little bit of a pout. So you like that look.
I do,
It gave you a little bit of a pout. And so that definitely is a growing trend, especially young patients are coming in, younger patients who like that kind of, that more averted lip look, or the pout look as you described. So we talked about your chin and some of the advanced areas in the lips. And then what other areas you mentioned about the frown, where at the side of our mouths we pull down to the side, right? And that is related to two muscles on each side called the DAOs, which stands for depressor, meaning pulling down, angularis, meaning the angle, and then oris. So you're getting your anatomy lesson today on Ask the Expert, the DAOs, and those pull down, and so they can constantly pull down and make you look like you're angry or having the resting not happy face. So having said that, we can inject those two little muscles in there, and we can actually, believe it or not, we can actually turn that frown upside down and make you look more smiling. So that's an area. Other areas that can be treated are the neck bands. So sometimes we can see bands that run from our jawline down to our chest, and that's related to a muscle called the platysma muscle, or the platysma bands. And when they get overactive, you can kind of see these straight lines coming down. And so we can inject that with Botox and Dysport to soften that, as well as injecting underneath the jawline, and that's called the Nefertiti neck lift. And by just injecting underneath the jawline, that can help to soften the jowls a little bit as well. So that's an area that can be done. So Wow, there's a lot that can be done with
Yes.
Botox and Dysport. It is our number one procedure. Thank you for being here, Karina, and,
Thank
and,
you.
and running through with us and telling our listeners how it can be a very safe and very comfortable procedure,
Right.
especially when you're in the room. And so if I'm doing your Botox or Dysport and you're there, I won't be hurt if you say, "Where's Karina?" And we'll call her and get her wherever we got her working, and we'll bring her in and have her help assist with the procedure. But it's a very wonderful treatment. The treatment is we set aside half an hour for our patients for that, even though it may take us about 10 minutes to do the treatment, because we want to evaluate you, listen to what you want, and educate you during the procedure itself. That lasts about 3 to 4 months, so you have to do it about 3 to 4 times a year if you like the results. And it is our number one treatment that we do in the office and has our number one greatest satisfaction rate. So if you're interested in this, please just give us a call at our office, and we'd be more than happy to set you up for a complimentary consultation, as you say. And you can meet Karina as well as myself. So I do want to thank all of you for listening to us on KSRO Ask the Expert.